Okay, so we're performing the IO procedure. So first you want to ensure that the scene is safe and that you're wearing the appropriate PPE, which is gloves and glasses. If you can, you want to explain the procedure to the parent or the if it's a young child, and gain consent. So IO should only be considered if IV access is unavailable. So you need to make sure that the patient is in a position of comfort, that there's adequate lighting. You need to make sure all your equipment's set out and that you have the appropriate size needle for the patient, so depending on their weight. And we've got here, so the sharps container, a syringe for the flush, alcohol swab, and the IV tubing, as well as this will be our IO drill kit. Okay, so you need to then identify the site. So for infants we use so making sure that the patient is supine, want to expose the site and then identify the site. So for infants they use proximal tibia, which is about 1 centimetre below the patella, and then medially 1 centimetre. So once you've identified the site, you then want to swab the site, maintaining aseptic technique. You may need to get the parent to hold, just depends. And then you want to attach the correct size needle onto the IO drill set. And holding at a 90-degree angle. Pop that in like that. And then, so the catheter's in, then you put the sharps in the sharps container. And then you want to, for infants, flush with about 2.5 mils of saline. So just make sure got 2.5 there. So first you want to aspirate back a little bit to get a bit of bone marrow, and then pop in 2.5 mils of saline. And then once that's done, you then attach the IV tubing, which will have the medication attached to it. So just with this. Okay, so you've attached the IV tubing there with the medication. So you then flush in the medication, and then you can attach, if they need to go on fluids, a primed extension line as well, full of fluids, and then you just secure that in place with some micropore tape. So any contraindications, so any known fractures at the site of the limb, also whenever possible avoid sites of burns, infection or localized cellulitis. And yeah, that's it.